anesthesiology. I'm going to spend a few minutes talking to you a little bit about behavioral interventions for chronic pain. So we begin with a discussion of behavioral therapy and cognitive behavioral therapy. These are both first-generation interventions and have been long studied and long used in chronic pain. But we'll also talk a little bit about some of the new generation of therapies, including mindfulness-based therapies, acceptance and commitment therapy, as well as positive activity interventions. And then we'll close with some resources for you. So what is it that we're trying to address with these behavioral therapies? The goal frequently is changing patients' thoughts, feelings, and behaviors. A critical treatment target is psychiatric comorbidity. Many of our patients suffer with depression and anxiety and other psychiatric comorbidities. These can all be addressed well with behavioral therapies. And poor sleep is an important treatment target. Many of our patients also sleep poorly, and this is something that we also want to improve to increase their functioning and improve their experience of pain. Avoidance and inactivity. We want to get our patients moving again and not fearful of re-injury. Pain catastrophizing is also something that needs to be addressed, as pain catastrophizing is often associated with poor functioning and worse pain. We want to teach our patients how to cope better and to have better problem-solving skills so we can decrease our levels of stress. And we want to address having an external locus of control. This is the belief that others outside of the patient are the ones who are responsible for healing and helping. We want our patients to have a more internal locus of control, to believe that there are things that they can do to improve their pain. And lastly, of course, we want to use these therapies to help our patients improve their pain, fatigue, and cognition problems that often go along with having a chronic pain condition. And we'll begin with the behavioral therapies. The goal of behavioral therapy is to change unhealthy or unhelpful behaviors through behavioral strategies. The core of the belief is that behavior is learned, and thus it can also be unlearned. And we focus on current problems and using new strategies to change these old behaviors. And so with behavioral therapies, there are a number of targets. Initially, we look at addressing dysfunctional pain behaviors like avoidance. This is where a patient will often not do things that they need to do for fear of re-injury. And some of the techniques that we can use involve exposure, where we teach patients that they can actually do things in an incremental way, such as slowly letting them know that exercise, if taken in gentle steps, can actually be something they can do. Or behavior modification, where here we use positive reinforcement and other types of strategies to get patients to slowly begin to do things that will be more helpful to them. And also modeling. This is a way of demonstrating for patients how to do an activity safely, or even showing them or modeling for them healthy behaviors. Another treatment target for our patients is changing the physiological processes that make their pain worse, such as anxiety and stress. And here we use predominantly relaxation types of techniques, like progressive muscle relaxation, which involves tensing and loosening muscles in a progressive way throughout the body, or guided imagery, imagining peaceful places and quieting people's breath and their muscle stress. And also breathing retraining. This is teaching patients to actually breathe at a slower level, and this helps them deeply relax. As for support for behavioral therapies, it's really quite good since behavioral therapies have been around for so long and studied so well. There's actually good evidence to support behavioral therapy for improving pain in both chronic pain patients and also even acute pain settings, such as individuals undergoing surgery. It's also good for cancer survivors and many, many different forms of chronic pain. Stemming from behavioral therapy is cognitive behavioral therapy. This is a therapy that involves the importance of our thoughts. It is believed that thoughts lead to our feelings, and these thoughts and feelings lead to how we behave. So what's more important than the actual situation is how an individual perceives that situation and what it means to them and what their reaction is. Here we try to teach patients how to think a little bit differently, which will impact how they feel and behave. The primary target for cognitive behavioral therapy in regard to pain is addressing their thoughts and behaviors. And we use a number of strategies. Some of them borrow from behavioral therapy, such as relaxation training. But also our goal is to get our patients moving too, to get them doing new things, actually beginning potentially to exercise. We also use thought records so we can start to understand how it is that patients think and what are some thoughts that are unhelpful. And then we begin to address these thoughts and reframe them in ways that might make them less distressing. We also focus on goal setting and problem solving. And one of my favorite activities is pleasant activity scheduling. And what we do here is encourage patients to do things that they enjoy in life. By adding these pleasant activities back into their life, not only do we get them moving, but they also can impact their emotions. And then, of course, cognitive behavioral therapy is quite excellent for addressing sleep. And CBT, the hallmark of it is homework, always homework. We have our patients doing things well outside of the session that makes their learning increase and makes the impact of the CBT even greater. The evidence for cognitive behavioral therapy is really quite strong. It is helpful for pain as well as functional status. We see CBT benefiting patients across areas such as chronic pain like fibromyalgia, but also in breast cancer patients and other conditions. Next, let's spend some moments talking about this newer generation of therapies. These mindfulness-based therapies are really quite powerful and popular. John Kabat-Zinn, one of the founders of mindfulness, noted that mindfulness is awareness that arises through paying attention on purpose, in the present moment, non-judgmentally, and it's about knowing what's on your mind. And thus, mindfulness-based stress reduction types of interventions focus on meditation, on body awareness, and yoga, all things that have been found to be quite helpful for patients with pain. The primary targets for mindfulness therapies are indeed increasing body awareness and also decreasing physiological reactivity. Here we teach patients to be mindfully non-judgmental of how they're thinking and acting in their daily life. We hope to promote serenity and a feeling of being present or mindful in each moment. And also we hope patients will experience a more joyful life and access their inner resources for healing. And using behavioral interventions like progressive muscle relaxation and meditation are all kind of the hallmarks of mindfulness-based therapies. For mindfulness-based therapies, there is some pretty good evidence for decreasing pain interference, improving mood, and functional status in patients with pain. We see this in different categories, such as fibromyalgia, as well as in a more general chronic pain populations. The next of our newer generation therapies is acceptance and commitment therapy, also known as ACT. And here the premise is to use an action-oriented approach to help individuals stop avoiding, denying, and struggling with inner emotions. These are common emotions that come to patients who have chronic pain. Instead, we hope to teach them to accept that these emotions are part of a normal process of adapting to a very difficult situation. And despite having these negative and troubling feelings and having this chronic pain or this situation, to still find a way to lead your life in a meaningful and productive way. The sense is that fighting feelings only makes you feel worse. The primary targets, thus, then, are helping patients accept their feelings and also commit to making necessary changes so that they can indeed begin to live their lives in a better way. We teach patients how to listen to their self-talk. What are the things that they're saying to themselves that might be undermining their ability to live their lives to their fullest? We help them decide whether or not an issue really requires action or change. Perhaps the best decision is just to let an issue lie. So then we also encourage individuals to decide whether an issue can just be accepted for what it is, but also still make these behavioral changes that could even affect the situation and make it better. And really the goal is to help our patients make a commitment to stop fighting their past negative emotions, and start practicing a more optimistic, positive, confident way of being in the world. Here, too, because ACT is relatively new, the data are starting to mount, but they are so promising. And what we're seeing, even in some studies, that there's a trend towards acceptance and commitment therapy potentially being even superior over behavioral therapy and cognitive behavioral therapy. And we see the biggest effect size for pain interference. In other words, patients actually being able to function better based on their experience of undergoing ACT. And lastly, let's talk about positive activity interventions. These are behavioral treatments, a lot like cognitive behavioral therapy, but unlike CBT, they focus on increasing positive states. CBT and other behavioral therapies tend to focus on decreasing negative states. So these resilience-based interventions target the enhancing positive emotions and feelings of well-being, and they also help behaviorally activate our patients. They get our patients moving because doing fun things is the easiest thing to do, and we often see people engaged in these happy interventions more readily than doing things that are more difficult or challenging. Positive activity interventions are built on the theory put forward by Barbara Fredrickson, known as broaden and build. And what that theory posits is that positive emotions broaden our thoughts and our options for action. They make us more creative and more flexible and more open to new experiences. Positive emotions also tend to undo the lingering effects of negative emotions such as anxiety and depression. And then lastly, having a lot of positive emotions can actually help you build psychological resources, meaning that people who are putting forward positive emotions draw people into them. By building these social support networks, people are better able to cope and to bounce back, because we all know social support is one of the most powerful resources a person can have. So the primary targets for positive activity interventions are helping people understand that by doing things that are fun and pleasant, they actually are able to better combat their pain. And in finding things that are meaningful to them, they can make their lives feel more worthwhile. And this can help decrease feelings of unpleasantness that are associated with pain, and as well as increase activity. So these positive activity interventions are based on focusing on positive reflection, which just means that as you look back over the day, what do you recall? Do you recall all the negative things that happened, such as a slight or a failure potentially? Or do you recall maybe one or two really remarkable positive things that happened? We want to teach our patients to focus more on those positive things. We also teach about character strengths, knowing that each person has a unique set of character strengths that makes them who they are. And by identifying these and teaching them new ways to use them, you can help empower people and help them connect more with others and to feel better about who they are and what they're doing. We focus also on purpose in life by helping our patients find meaningful activities, and a purpose in life after the pain can really help improve level of functioning, feelings of pain, and feelings of despair. And then lastly, engaging in pleasant activities, as we saw back when we talked about cognitive behavioral therapy, is a great way just to get people moving again. So positive activity interventions are unique because many of these are something that's easily delivered by clinicians who are not psychologists. We mentioned before pleasant activity scheduling. That's a great thing that anybody can recommend to their patients, that they just take the time to put things on their calendar that they love to do and treat that like a doctor's appointment with that level of seriousness and actually do these things, be it have a cup of coffee with a friend or go to the movie or just walk the dog. But other interventions include gratitude journaling. That's just making notes of things that you see during the day for which you feel grateful. Conducting random acts of kindness throughout the day. Savoring a beautiful day is just another way of saying being very mindful and spending a few hours really, really loving an experience or spending the time to make a beautiful experience with friends or family. Other activities like My Victorious Self involves thinking about you 10 years from now. Given your new circumstances, what can you do that would make you feel really strong and victorious and happy? What would that look like? We mentioned character strengths before, identifying these and using these in a novel way. And also positive service. Getting out of yourself a little bit and potentially volunteering. The feeling that comes with helping others can buoy one's spirits beyond almost anything else. So the evidence for positive activity interventions, again, not as well established as many other interventions, but quite good for decreasing feelings of depression and anxiety, as well as improving some level of pain intensity, as well as feelings of having some control over your pain. So the way we see these fitting together, these traditional therapies like behavioral therapy and cognitive behavioral therapy, and these new generation therapies like ACT, mindfulness, and positive activity interventions, is working them together, tailoring them for patients, using combinations of these so that they are most advantageous for a patient's particular needs or wants. So while all of these interventions are not easily deliverable by any healthcare provider, it is easy to find psychologists in your neighborhood. And one way to do that is to use the American Psychological Association's Therapist Finder. and the link is provided there. What you can do is you can log in what you're interested in, as in finding a therapist who does behavioral therapy for chronic pain. You can log in your address, and you'll be able to locate psychologists in your area. Also, we have posted some self-management tools for patients to use. These are free of charge, available at our website, one of which is Fiber Guide, which has most of the behavioral therapy and cognitive behavioral therapy interventions that I discussed earlier, and then a new tool called Pain Guide, which will also include some of the new generation therapies that should be coming soon. So with all that, I thank you for spending a few minutes listening to what I have to say about behavioral interventions, and hope that you'll be able to use these with your patients.